Welcome everyone to another beautiful day. Today is going to be a great topic as usual. Let me go ahead and remove this. I want to say welcome to everyone. Hopefully you had a nice day today on this beautiful Sunday. So some people out there may be Monday, but today is going to be an interesting topic as notifications are going out right now worldwide. But today's topic is going to be about forward head posture, hunchback, in reference to a thoracic kyphosis, and is going to be related to shoulder problems. Many of our shoulder problems that we hear about on a regular basis are tied into forward head posture. That is a biggie. Forward head posture is something that is destructive worldwide. We look at what's going on in the world out here, but I'll tell you, these potential problems can lead to a lot of significant conditions. Here you can see the kyphosis in the second picture on the left. As you see the lumbar lordosis on the lower part, and you can see a scoliosis. To give you a better understanding that a scoliosis, just I thought for an educational purposes, is a deviation of the spine, looking at it from back to front or front to back. But our two main things here, hello Scotland, hello Italy, hello Paula. Our two main things we're concerned about is look at that lordosis in the lower back. Lumbar lordosis leads to forward anterior pelvic tilt, which we'll go into briefly, but basically forward anterior pelvic tilt means that the butt sticks out. You become more hyperlordotic in that lower back where it says lordosis. And as a result of that, the kyphosis in the mid-back area becomes more accentuated. See, the forward head posture goes forward. We get more accentuation in the upper back and more increased curve in the lower back, causing the pelvic to rotate forward like this, causing lots of other conditions. So it is all tied in to forward head posture as well as anterior pelvic tilt. But here, as you see, we are looking at a kyphosis. We're looking at an accentuated upper back area as a result of the tight pecs, which we'll go into after. I'll show you some stretches and things you can do. Elongated, weak muscles behind the neck. The rhomboid muscles between the shoulder blades, which I'll show you after, become very weak. And I'll show you basically things we can do to help that. And those actual erector spinae muscles, or the muscles along the spine, are becoming essentially stretched and weak as well. As we move forward, I have lots of good pics to show you guys, so we'll kind of move quick, and I'll come to the chat room a little later. As you see here, just texting, looking at my phone here, you can see the degrees. For just 15 degrees, there's 27 pounds of stress in the back of the neck, the load on the discs. 30 degrees, there's 40 pounds of stress. 45 degrees forward, there's 49 pounds of stress. 60 degrees forward, like looking like this, like many of us do day after day. The weight of the head weighs 12 pounds. And as a result of this, this puts excessive burden upon the back of the ligaments, causes pronation, rotation of the shoulders, causing the chest, the pec muscles to become, hello Pakistan, it causes the chest muscle to become completely contracted and shortened, causing a lot of deformity and a lot of conditions, which we'll go into in just a minute. This picture here shows a dowager's hump. I have a daughter a young daughter who is developing a dowager's hump as a result of texting for over years. I can tell you, adults, watch over your children as well as watch over yourself and your spouses, because this is a hump that is hard to get rid of. This is more an advanced osteoporosis, but you do not have to have osteoporosis to develop this hump. This is a fatty hump, starts to bulge out. Many of you may have it already. And hello, Croatia. So this is very important that forward head posture is destructive because the weight, again, going forward, 12 pounds here. If you look from the side, for every inch I go forward, an additional 10 pounds, 22 inches, 1 inch, 32 inches, 2 inches, and 42 inches, 3 inches, at 32, 2 inches, and 42 pounds of stress that the back of the muscles have to withstand and take up. If you look here, you look at forward head posture. This is a little bit more complex, but I just wanted to give you an idea. There's a lot of things that can encompass this. There's double crush syndrome, people that can develop pain into the arm and hand, tingling numbness. Double crush syndrome as a result of carpal tunnel syndrome, as a result of nerve root compression irritation. Cervical radiculopathy, radiculitis. Pain, hello Bosnia. Pain going into the shoulder blade, chest, as well as down the arms. Also, we have a neurovascular bundle. We have the thoracic outlet syndrome, which is a group of nerves as well as the vessels that travel from the neck that make its way down into the arm and hand. And as a result of this forward head posture, it can affect the peripheral nerves, the peripheral vascularity, cause tingling, numbness, cramping into the arm or hand. Many times physicians will we love you too, by the way. Many physicians will take MRIs and show that, you've got compression, you've got a herniated disc, and we want to do surgery. Got three things I want to remind all you guys. I'll save you lots of future problems. Three things. One, if the muscles are not atrophying and they're not getting weaker, they're not losing strength, and they're not wasting away, and your reflexes are normal, you're not a surgical candidate. You need to stick through the pain, let the body heal, repair, and you do your exercises and do the right thing so you can get well again. Dangers of forward head posture, the center of gravity moving forward. Obviously, the upper thoracic area back in here starts to compensate, and we start going through all this type of deformation. And you can refer back to this type of chart. This will be posted on my channel right after we're done. Here shows you something that you don't want to look for. This guy looks like a madman. I figured a little bit of sense of humor, but you don't want to be walking around like that. You're going to have lots of problems. You see people walking around that. You can see the changes here from a normal curve to a forward head curve to a very accentuated forward head curve. Not good. Very common, and it is becoming a serious epidemic. Yes, we all are looking for solutions, but the reason why this program is so important, the reason why you can go back to my videos, I have over 1,000 videos, many of them on forward head posture. The leading videos here on YouTube are my videos. If you type in neck pain, all the videos are coming up front because these are the videos that are helping lots of people, adults, not only adults, but children as well. The kyphotic posture that we're talking about in that upper back area, this is a big problem, all stemming from forward head posture. Again, remember that chin is forward, the cervical spine is hyperextended like this, kind of looking upwards, and we are getting significant tightness in those pectoralis muscles. If you look here, the kyphotic lordotic posture, we can see basically what happens. The hyperlordosis, that neck kind of juts forward as we compensate all the way down the pelvis, and it actually affects all the way down into the knees and ankle joints. Now, the issue here, people ask me, well, can this problem cause this problem below? Absolutely. But can problems below cause problems above? Yes, it can. So you need to be certain. For example, we did a program on pronated feet, when the feet go inwards like this. That can cause changes in the angle of the Q angle of the knees, causes the inward change of the hips as well as forward rotation of the anterior pelvic tilt. And I want to let you know there's a lot of people out here talking about how to correct anterior pelvic tilt. You need to address forward head posture. Because if you don't address forward head posture, your body can work from above down or above or below above. So you need to really look at both sides of the body. It's like you don't want to leave one thing out. That can cause problems, okay? Here's a picture here that just shows you the deformation, the changes, because these things, if it gets real bad, it's going to be very, very hard to correct. These are stages of degeneration. As time progresses, you can see a reversal of the curve. Many of you have told me, hey, you know what? My curve on my neck is reversed. It's straight. Now, as a result of the curve, okay, here's a normal lordotic curve. This is the way it should be. Okay, guys, you can see this. Now, as that curve becomes straighter, we have more stress. Here's the problem. The problem is that the weight of the head starts compressing down on the discs. Because now you see when we have a lordotic curve, the weight of the head is compressing on the facet joints back here. So it's not putting it on the anterior part of the vertebral bodies. So when the curve becomes straightened out, we start getting more load on the disc, more disc degeneration, herniated disc, bulging discs, and that can cause a lot of distress along those nerve roots. You can look back at this later. Now, the question here, you're saying, well, what about shoulders? Well, shoulders, what happens is, when you look at the shoulder here, we can see that bursa underneath in the subacromial region, that bursa filled with fluid, inflamed tendon. This can eventually cause significant shoulder problems. It's hand in hand that I have found that the majority of people with forward head posture always have shoulder problems. The majority of people have shoulder problems. They get chronic bursitis, tendonitis. They get bicipital tendonitis. They get potential rotator cuff problems, degeneration, calcific formation upon the tendons. Realize that this stuff is real. And I can tell you that you correct your forward head posture, your shoulder problems are going to probably get a lot better. All right, because you are, with forward head posture, you're pronating the shoulders forward, you're internally rotating it. Look at my shoulders. I'm rotating forward. I'm closing off that space under that subacromial. See that acromial region where that yellow mark is right there? That is narrowed. That's narrowed because of pronated or rounded shoulders. So when that becomes narrow, you are going to get more compression. There's a joint in the glenohumeral joint. If you look glenohumeral joints to right side, if you look above, that is underneath the acromion region. That is kind of compressing upwards. And that is showing degeneration from wear and tear. Here's a picture here showing A to P internal rotation. You can see less space up in there because it's internally rotated. My shoulder's going inwards. You're going to say, what is internal rotation? Well, we'll get to that. Here's impingement. Impingement basically states that you're getting weakness when you raise your arm. Okay, you're getting a catching in there. This involves a rotator cuff tendon, rotator cuff, and potential impingement as a result of other tendons, the rotator cuff, and or the subacromial bursa, the bursa that runs underneath there. It's getting trapped. Now, I want to just show you an experiment, a little test that we can do together. I think you'll be able to see us. I'm going to back off a little bit. Now, what I want you to do, bring your ears over your shoulder right now. Okay, now what I want you to do, I want you to take your arm and take your shoulder like I'm doing here, okay? I want you to lift it up. Go lift it up over your head. All right, lift it all the way up. All right, good. Okay, now when I bring it down, now what I want you to do, I want you to take your head, I want you to accentuate the forward head posture. So take your head and bring it way forward. Go ahead, way forward, okay? Now take either arm, it doesn't matter. Take that same shoulder you just lifted up and lift it up now. Go ahead, lift it, lift it, lift it, lift it. Come on, more. You can't. You physiologically can't. And that's what I'm trying to get you to understand. Why wait for the shoulder problem or the pathology to get worse and not knowing it when I just showed you a test that you can artificially create an accentuated forward head posture and you can't lift your shoulder because you're narrowing in the space. You're compressing on the rotator, compressing on the subacromial bursa, the tendons, and everything going in that joint space. You're narrowing it by that forward head posture. So how do you correct the shoulder problem? You don't correct the shoulder. You got to correct the forward head posture because that's what's causing these majority of these shoulder problems. These orthopedists, people worldwide, they don't get it. They don't talk about forward head posture. I can tell you, I've had bursitis, chronic bursitis, from chronic looking down. And guess what? My bursitis did not go away from correcting my shoulder. My bursitis went away by correcting my forward head posture and getting my stabilization correctly and trying to open up the pecs. If you look here, here's rotator cuff tendonitis. The causes, okay, you can look above this. We'll just kind of tell you what hurts you. You can look at this later. And internal rotation. This is internal rotation. It's 45 degrees, okay, when you go this way, 90 degrees when you go all the way down. But I want you to understand what internal rotation is because internal rotation means going forward, pronation, tight pecs. People who have forward head posture will have rounded forward shoulders. A big, big thing. This leads to lots of problems. And guys, if you understand this, you're going to get well. You're going to get well. Here is a x-ray of degeneration of the neck showing spinal spurs up in front, showing discopathy, the disc starting to eat away because of the forward head posture. All right? It takes time, but in certain people, it may take half the time. You can be 30 years old and look like a 50, 60, 70, 80-year-old spine, or you could be 60 years old and you can have a 25-year-old spine. I see it every day. So I just want you to understand that. Now, if you look at the rhomboids, these particular muscles right here between the shoulder blades, these are usually stretched and weak in forward head posture. You need to strengthen these. And the best way to strengthen these muscles, okay, you can just lay on your stomach and bring your arms out. You can put weights in there as you get stronger and just squeeze your shoulder blades together. All right, very good exercise. Here's another one. All right, you can, again here, you want to make sure, and here's a little tip for you, is that when you have forward head posture and you have pronated shoulders, you'll notice that the back of your hands are facing more forwards than the front of your hands, okay? These are the front of my hands. They should be facing forward, Okay, so when they face back, when the back of your hands are facing forward, that means your shoulders are internally rotated. If your thumbs are facing outwards and your palms are facing forward, that means you're externally rotating. So you want to get in the habit of, let me stand up here. Okay, you want to get in the habit of, look at my hands here. I'm trying to stand up, of externally rotating. See the one of my hands? I'm trying to external, open it up. You want to open up those hands, and then you can pinch your shoulder blades together and pinch them down into your back pocket. It's real good to help strengthen up those rhomboids. All right? Another thing, for the pecs, get inside a door. Stretch those pecs. Don't be afraid. Stretch those pecs. You stretch those pecs, you're going to thank me. You're going to come back and say, wow, I feel like I can stand up straight. I'm not getting pulling, because those tight pecs is the #1 reason for pronated shoulders. Okay? So you want to stretch those pecs. I want you to start getting into the habit of doing external exercises, external rotation, of coming outwards. Don't start working inwards too much, because your inward muscles, your internal rotator muscles, are already weakened, so you can't continue to do that. Here's another good one for the chest. All right, I like this exercise. You can do this everywhere, anywhere. You guys have done it over and over. You know what this is all about. Okay, I think that is a great exercise as well. So, when we look at these particular problems, and when you realize, when you're getting this poor posture, this is what it's all about. It's all about prevention. It really is. And I say it with love to you guys, because I've seen this stuff for several decades, and I know what it's like, and I've seen people degenerate in front of me because they ignore easy conditions that you can start getting well for. Now, the simple ones, the chin tucks, I don't know if I put the chin tucks in there, but the chin tucks, basically, you're going to put your hand underneath your chin and just going to push back, just kind of gliding like a table. Okay, so from the side, all right, I'm just going to go ahead and push back like this. Okay, these are chin tucks. Okay, you can take a towel, all right, I'll pretend this is a towel. You can put it behind your head, okay, keep your chin level, and you're just going to jump back against the towel, okay, just like this. Okay, you can lay on a pillow and just push your head, jump back into the pillow. You can lay on your stomach and your head's just going to lift up. Okay, when you're on your tummy. So there are many different ways you can do it. I like the towel one, by the way. I like to put a little resistance on here. That's a real good one. And anyways, these are great things to do, but make sure you stretch the chest and realize that if you're suffering from a chronic shoulder problem, get in tune with that forward head posture, because I guarantee you, if you're having shoulder conditions, you're having forward head posture, probably in about 95% of these cases. All right, look at your work, look at your ergonomics, look at your occupation, look at the things you do, look how often you keep your head down, typing, look how often you keep your arms elevated, look how often you keep your hands on the steering wheel when you're driving. You're still in that forward head posture. So this lumbar support, okay, see this pillow right here? See if I can pull this up for you a little bit. Okay, this pillow right here, you need to get a support behind your lower back when you're sitting, or take a rolled up towel or rolled up pillow, because this will help you get the shoulders back. That's correct. It will help you get the shoulders back. So you need to make sure that if you're sitting a lot, you need to get a support underneath, in between that lower back area. Let's look right here. This lumbar spine, you want to fill this gap. You want to get that lumbar pillow right in here to make sure that you're not doing this. Because what this will do, when you support that lower back, this is what happens to my shoulders. Comes back. Without a support, the lower back hunches like this, my lower back hunches, my shoulders go forward, and I'm back in that forward head posture. So it's just not looking at your neck. You need to look at the entire spine. I'm going to leave you one thing, guys, and you'll remember this. I'm sure you'll never forget this as long as you live, okay? When you bite the back of a dog's tail, okay, you guys with me? When you bite the back of a dog's tail, he barks out of its mouth. So that means in our body that when we have a problem somewhere, we need to look for the source of the condition, because there are other things tied together with that particular problem. Your problem is just not neck. Your problem is just not shoulder. There's something else going on with that problem. So if you can address it and sustain it and keep it strong, other conditions will heal. The reason why our bodies break down is because it's unstable. Something is weakening it. There are stressors. Whatever the stressor may be, there are stressors that are affecting this. So we need to really be aware of this, take precaution, and do the right things. But remember, strengthening is the most important thing. I had a person keeps asking me, what about, can I wear my neck support? Can I wear my back support? Forget about those supports. If you have an acute injury, you may wear it for a day or 2 or 3 days, but supports make muscles weak. And what make muscles strong are strengthening exercises, balancing the body correctly. Okay, guys, I just want to say thank you. I'll go to the chat room a few minutes now thereafter. I really appreciate you guys, and I recognize a lot of the names. Hi, Janine. I just want to say I love you guys very much. You guys have been very loyal, and I really appreciate you guys being here. You probably won't hear any, well, I don't want to say it now because this will be recorded on my channel. So anyways, we'll continue to keep up and keep in touch. You have questions. By the way, Facebook, Motivational Doc on Facebook is basically the easiest way to get a hold of me. That's the place I'll always respond the majority of the time. I get about 300, 400, or 500 emails sometimes a day, and it can get a little monotonous, and I can't go through all those. But since you guys are in the chat room, and I'm sure people will hear this later when they hear it, Facebook, Motivational Doc is the easiest way to communicate. Anyways, guys, have a great day wherever you are, a great night if it's nighttime there. I'll head to the chat room, and again, I want to say